Pacemakers, Advanced Nursing Practice 5 Marks Introduction. Pacemakers are the electrode devices that can be used to initiate the heartbeat when the heart's intrinsic electrical system cannot effectively generate a rate adequate to support cardiac output. Currently available permanent pacemakers contain a pulse generator and one or more pacing leads simultaneously. Further innovations in the pulse generator and its circuitry extended the utility of the percutaneous technique even in the very young patients. Definition: pacemaker is an electronic device used to pace the heart when the normal conduction pathway is damaged or diseased. A pacemaker is a battery-operated generator that initiates and controls electrical stimulation of the heart via an electrode that is usually in direct contact with the myocardium. A pacemaker is an electronic device that provides electrical signals to stimulate the heart muscle. Pacemaker is an electronic device used to pace the heart when the normal conduction pathway is damaged or diseased. Components of pacemaker: pacemaker components combined with body tissue to form a complete circuit. Pulse generator, power source or battery that provides the energy for sending electrical impulses to the heart. Pacemaker electrodes: pacing lead or wires. Healthy myocardium: cathode, negative electrode, anode, positive electrode. Body tissue: function of pacemaker: pacing function, sensing function, capture function. Pacing function: it is the ability of the pacemaker to stimulate either the atrium and ventricle or both chambers in sequence and initiate electrical depopularization and cardiac contraction. Atrial pacing, ventricular pacing, atrioventricular pacing. Sensing function: cardiac pacemaker have the ability to see intrinsic cardiac activity when it occurs. Capture function: the ability to generate a response from the heart contraction after electrical stimulation is referred as capture. Working of pacemaker: a pacemaker consists of a battery, a computerized generator, wires with sensors at their tips called electrodes, the battery power of the generator, and both are surrounded by a thin metal box. The wires connect the generator to the heart. A pacemaker helps monitor and control the heartbeat. The electrodes detect heart's electrical activity and send data through the wires to the computer in the generator. If heart rhythm is abnormal, the computer will direct the generator to send electrical pulses to the heart. The pulses travel through the wires to reach the heart. Types of pacemaker/pacing methods: 1. Permanent pacemaker. 2. Temporary pacemaker. Permanent pacemaker. In an operating room, the pulse generator, a small hermetically sealed lithium battery weighing from 30 to 130 gram, is placed into a small tunnel burrowed within the subcutaneous tissue below the right clavicle. The pacing electrode is inserted through a transvenous route, most common, or directly applied to the epicardial surface by thoracotomy. Implanted totally in the body. Power source is implanted subcutaneously, usually over the pectoral muscle on the patient non-dominant side. Types of permanent pacemaker: 1. Single chamber pacemaker. In this type, only one pacing lead is placed into a chamber of the heart, either the atrium or the ventricle. 2. Dual chamber pacemaker. Wires are placed into chambers of the heart. One lead paces the atrium and one paces the ventricle. Closely resembles the natural pacing of the heart. 3. Rate responsive pacemaker. It has sensors that detect changes in the patient's physical activity and automatically adjust the pacing rate to fulfill the BOTUS is metabolic needs. Indication of permanent pacemaker therapy: chronic atrial fibrillation with slow ventricular response, hypersensitive carotid sinus syndrome, fibrosis or sclerotic changes in cardiac conduction system. 6. Sinus rhythm tachyarrhythmia, third-degree AV block. When a patient has a permanent or temporary slower than normal impulse formation, ventricular conduction disturbance when some arrhythmias do not respond to medications. 2. Temporary pacemaker. It is one that has the power source outside the body. The pulse generator is external and the pacing electrode is inserted by transvenous, transthoracic, transoesophageal, or transcutaneous route, either at the bedside or under fluoroscopy. Types of temporary pacemakers. There are 3 types of temporary pacemakers. 1. Transvenous invasive pacemaker, endocardial. It is preferred in emergency situations. It requires a hard-tipped or balloon-tipped pacing lead to guide into the right heart and into contact with endocardium. It consists of lead or leads that are threaded transvenous to the right atrium and or right ventricle and attached to the external power source. 2. Transthoracic invasive pacing, epicardial pacing. This route is most invasive, requiring attachment to an epicardial pacing lead. During open heart surgery, it is achieved by attaching an atrial and ventricle and attached to epicardium during heart surgery. These leads are passed through the chest walls and attached to the external power source. 3. Transcutaneous pacemaker. Non-invasive pacing. It is used to provide adequate heart rate and rhythm to the patient in an emergency situation. Indications of temporary pacing: maintenance of adequate heart rate and rhythm during special circumstances such as surgery and post-operative recovery. Cardiac catheterization of coronary angioplasty. Before implantation of a permanent pacemaker. ASH prophylaxis after open heart surgery. Acute anterior myocardial infarction with second-degree or third-degree atrioventricular block or bundle branch block. Acute inferior myocardial infarction with symptomatic bradycardia and atrioventricular block. Pacemaker function. The cardiac cycle normally begins with the client's own beat. The pacemaker sensor sveta. The intrinsic beat has occurred. If not, the pacemaker send out an impulse to begin myocardial depolarization through a pulse generator. The impulse generator is said to capture the myocardium and thereby maintain heart rhythm. Limitations: the LCP pacemaker is not appropriate for patients requiring dual chamber sensing and pacing. There is a possibility of device dislodgement and migration into the pulmonary vasculature. Nursing management. Preoperative care. Financial: explain the procedure, type, and technique of pacemaker to the patient. Explain cost of the procedure and hospital stay. Psychological: explain the process of the pacemaker. Reassure the patient. Physical: obtain written consent from the patient and from nearest relative. Remove dangerous jewelry and contact lenses. Clean and save the area. Check vital signs, temperature, BP, pulse, and respiration. Patients requiring a pacemaker may be on oral anticoagulants. Standard practice was to discontinue warfarin 48 hours before the procedure, bridge with intravenous Riparin, and then reinitiate warfarin in the day of the procedure or even the night before. Antibiotic profile: access is a controversial issue, but most implants prefer to give oral or intravenous antibiotics to decrease the incidence of local or systemic infections based on limited data available. Intra-operative care: check serology like HIV, HBsAg, HCV, and others. Start with intravenous line with 5% dextrose solution or normal saline solution. Check the battery in pulse generator. Prepare the emergency cart, the defibrillator, and jelly. The ECG monitor. Set up all equipments for the insertion of the pacemaker. The nurse should know about the pacemaker generator, including the power switch, indicator light for placing and sensing, stimulus output dial, and their other proper settings. Assist the doctor and the scrub nurse during the procedure step by step. Observe vital signs and observe ECG monitor carefully for arrhythmias and other complications. Post-operative care: receive the patient, keep the patient in comfort position, record the pacing parameters, receiving time, patient's heart rate. Other routine care: immobilize the affected part and keep in supine position but allow the movement of the finger and ankle joint. Monitor heart rate and rhythm, monitor vital signs and level of consciousness of patient, prevent infection, take electrocardiography and chest x-ray, watch for complications. Patient and family. Teaching objects that contain magnet: example, the earpiece of a phone, large stereo speaker, jewelry, and wraps should not be near the generator for longer than a few seconds. Advise the patient to place digital cellular phones at least 6 to 12 inches away from the pacemaker generator and not to carry them in a shirt pocket. Patient should be cautioned to avoid such situation or to simply move farther away from the area if they experience dizziness or a feeling of rapid or irregular heartbeat. Battery replacement: most pacemaker batteries last 6 to 12 years. Replacement requires outpatient surgery to open the subcutaneous pocket and replace the battery. Tell patient that, for the first few weeks after receiving pacemaker, do not raise arm the one closer to the pacemaker site, about the level of heart. Keeping arm down will help the area heal and keep the lead from moving. Do not shower until the third day after the procedure. Gently wash the insertion site, but do not put lotion or powder on it. Battery replacement: most pacemaker batteries last 6 to 12 years. Replacement requires an outpatient surgery to open the subcutaneous pocket and replace the battery. Placement of the pacemaker generator and leads in relation to the heart. Maintain follow-up care with a physician to check the pacemaker site and begin regular pacemaker function checks. Tell all your healthcare providers, including your dentist, that you have a pacemaker. Do not do any arm exercises and do not do tasks or activities like sweeping that require you to repeatedly move your arm for 1 to 2 months. Do not lift, push, or pull anything that weigh more than 2 to 3 kilograms. Including children. Watch for signs of infection at incision site, redness, swelling. Dressing: keep incision dry for 1 week after the implantation. Avoid lifting operative side arm above shoulder level until approved by care provider. Avoid direct blows to generate or to large magnets such as MRI scanner. These devices can reprogram a pacemaker microwave oven, are safe to use and do not threaten pacemaker function. The patient should be taught how to take the pulse, carry pacemaker information card at all the times, follow-up care, other nursing care, continuous ECG monitoring of heart rate and rhythm, monitor vital signs for every 15 minutes, monitor urine output, observe for the presence of dysrhythmias, avoid injury post-insertion, chest X-ray, monitor sign and symptoms of hemothorax and pneumothorax. Evaluate continuously for evidence of bleeding, monitor for evidence of lead migration, auscultate for pericardial friction, rub, provide an electrically safe environment, prevent infection, relieve anxiety complications, hematoma, pneumothorax, failure to sense or capture perforation of atrial or ventricle septum, ventricular atrophy and tachycardia, movement or dislocation of lead, cardiac perforation, infection, endocarditis, thrombobite, lebedes, myocardial perforation, diaphragmatic stimulation, ventricular ectopy and tachycardia from irritation of the ventricle wall by the endocardial electrodes, hemothorax, phrenic nerve, diaphragmatic or skeletal muscle stimulation if the lead is dislocated or if the delivered energy is set high, pacemaker syndrome, hemodynamic instability caused by ventricular pacing and loss of arterial ventricular synchrony, prevent or treat complications, prophylactic antibiotics and antibiotic irrigation of the subcutaneous pocket prior to generation placement of has decrease the rate of infection to less than 2% if bleeding or hematoma occurs. Use of cold compresses. The sides is carefully inspected for purulent drainage, erythema, and edema, and patient is observed for the signs of systemic infection. Frequently ECG monitoring to detect cardiac perforation, because this condition can be recognized by the changes in QRS complex morphology as symptoms of perforation that include pleuritic chest pain from pericarditis, diaphragmatic or intercostal muscle stimulation, and in the presence of pericardial effusion, patients may develop shortness of breath and hypotension as tamponade develops. Assessment of sign and symptoms of pneumothorax, hypoxia, shortness of breath, pleuritic pain, and hypertension. Assessment of dysrhythmias and treat as indicated after implanted the pacemaker. Nurses should minimize patient activity to prevent dislodgement of the pacing electrode. Nursing diagnosis: acute pain related to insertion site and prescribed process procedure. Immobilization: disturbed self-concept related to perceived the loss of health and dependence on pacemaker. Impaired physical mobility related to incisional site pain. Activity restrictions: risk for infection related to operative site, risk for ineffective therapeutic regimen management related to insufficient knowledge of activity restrictions. Precautions. Conclusion: a pacemaker is an electronic device that provides repeated electrical stimuli to heart muscle when the patient's intrinsic pacemaker fails to provide perfusing rhythm.